Okay, so it's 1 o'clock. We'll go ahead and get this session kicked off today. My name is Rose Locklear, and I'm from the Oregon Office of Rural Health. I'm delighted that Rod Harwood will be joining us today to discuss some techniques to fill the day with meaning. This session was really um, brought brought and created because we have so many folks right now who are dealing with isolation and loneliness, and this is a topic that's been covered quite extensively by various organizations. And so we wanted to sort of take it to the next level and talk about strategies and techniques to find purpose in your daily life. So I want to thank each and every one of you for being here today and start by orienting you all to the platform and the Oregon Office of Rural Health. We usually do an annual forum on aging in rural Oregon. And this year we were scheduled to do that at the end of May and had a bit of a pandemic on our hands. So we're doing sessions each month like this, and they're posted on our website at the link down at the bottom of the page here. So you can find this one um, after the fact and ones that have been done previously here on the forum the forum web page. But to orient you with this platform here, so we've got a kind of a smaller group today, so will afford us some interaction at various points throughout this presentation. So if you hover your mouse kind of down around the bottom middle of your screen, you'll see some buttons pop up. We've muted your audio, so please use the chat and Q&A feature. So if you hover the third button in on the right, there's a little chat box. If you click on the chat box, that will populate the chat and the QA over on the right side of your screen. Again, for the chat, that is if we ask any questions about, your experiences or you want to share, please use that chat function. If you have questions throughout this presentation for our presenter, Rod, Chris, our moderator here today, she's going to read those questions at the end. So that's the one that you'll really be wanting to use there, that little chat bubble. We've also muted your video just to cut down on bandwidth. And I think I've covered everything on that slide. I will let you guys take it away. Thank you so much.
Thank you, Rose. Excuse me. Hello, everybody. I am Chris Bowler. I'm the Older Adult Behavioral Health Manager at Greater Oregon Behavioral Health. And I am going to tell you a little bit about the Older Adult Behavioral Health Initiative, which is an initiative that both Rod and I are part of. And this started about late 2014 to meet the needs of older adults and persons with disabilities who their needs met. We're here to help improve the quality of life and systems of care for older adults and people with disabilities. So there are 24 other specialists throughout Oregon. Every county has representation. And what we do is conduct community education, workforce development trainings. We do complex case consultations for people who really need some help serving the older adults or people with disabilities they're working with. And we help engage and encourage collaboration with other agencies in communities to improve outcomes for older adults. If you want some more information, there's a couple web links down below on this slide, and you'll have access to that after the training. Our GOBI programs, you can see that website, and there is a website specific to the initiative, and it's oregonbhi.org. They have lots of information and statistics by county, actually, if you're interested in looking at that. So we do have our program evaluated by Portland State University. After this training, you will receive an email evaluation tool from Portland State University. Please do look for it and take some time to fill it out. They report back on the initiative and they report back to the legislature to help keep great programming like this funded. And again, I want to say thanks to Rose and the Oregon Office of Rural Health for partnering with us on this training. It's very lovely to work with them. And I'm going to introduce Rod to you. Rod Harwood is an older adult behavioral health specialist, and he works in much of Eastern Oregon. In his role, he promotes enhanced collaboration and coordination among agencies serving older adults and ensures that the people who care for older adults are well trained. Rod provides a training on a host of topics related to older adult issues. If you're familiar with TIPA SNO's positive approaches to care, Rod is a certified trainer for that. Rod has 30 years of experience providing clinical support in hospitals, mental health, and hospice settings. So with that, I'll turn it over to Rod, and thank you for joining us today.
Well, good afternoon, everybody. Thank you for joining me here on this topic today. I hope that you are well and staying cool on this hot Northwest day. This topic has been bubbling up a lot over the last few months, and it inspired me to reach out and draw from resources that I've had over the years. Really, those resources, what I'm sharing today, doesn't necessarily come from me, but it comes from my mentors, from many others who I've been blessed to have in my life that have taught me in terms of filling my day with meaning. So this training today will explore how factors such as spiritual wellness, personality style, health, and usual daily routine have a role in building and maintaining meaning and relationship and hope for older adults in the midst of this crisis. Our objectives that we're covering today is to understand how changes imposed by the epidemic impact spiritual, emotional, and physical health. I'll be introducing you to a spiritual health assessment. It's nothing complicated. We're actually going to be walking through it today. It's something that can easily be used for yourself and for others to understand the basic needs of the human spirit and how things are going well within. And we'll be building a framework for building a person-centered balance of activities that fill the day with meaning for each older adult. As older adults, aside from the pandemic, they have many different challenges that we face. And this is just listing a few, and we could probably be adding more to that. But caregiving and mobility and daily living activities, transportation, financial wellness is just a few. And depending upon the moment, depending upon the day, one becomes more prominent than the other, or again, they all impact each other. Looking at this model here is as far as time use, this comes from the Bureau of Labor Statistics, the American Time Survey, Youth Survey. They looked at how older adults spend their time, and this does not incorporate the pandemic, but prior to that. And if you notice that older adults is 65 and older on average, again, across the 7-day period, sleep about 9 hours a day. Their work-related activities, about 1 hour a day. If you'd spread that over a week, about 7 hours. Obviously, as older adults, they're probably retired and not necessarily doing at least paid work, could be, but other work-related activities. Household activities, 2 hours. But one of the things I want you to notice is there's 5 hours there that are unaccounted for. 5 hours as people transition into being older adults, oftentimes are not filled. And it's the adjustment of where before maybe as a parent taking care of your children and taking them to practices and going to work, you didn't have the luxury of those 5 hours a day. It was noted that there was 5 hours where it was not filled. But with the pandemic, there's many challenges when we've seen these sort of images where as older adults feeling not able to connect with their loved ones and loved ones struggling trying to connect with them. And I've heard from some of the care facilities I've worked with where early on family members literally trying to break in and see their loved one. but having to stay behind closed doors. But some older adults making the adjustment and connecting technology wise as these older adults are connecting maybe with their grandchild here, but not all older adults have been able to necessarily do that or feel comfortable with it. And obviously, it can never take the place of having that grandchild sitting in your lap. One study that shows the impact of the quarantine upon older adults is it shows they had a high prevalence of psychological distress symptoms, 29% experiencing post-traumatic stress, 31% experienced depression, and many of them describe about feeling isolated, particularly affected by the lack of that social and physical contact with their family members. One of the other things we need to look at is how this pandemic even is affecting our primitive brain, that part of the brain that we really don't think about. It's not part of our normal thinking process. It's just working all the time, keeping our heart going, keeping our blood flowing, things like that. And that primitive brain, the autonomic functions that it does, it notices that maybe if your activity's picking up, your heart rate increases. If it slows down, your heart slows down. You don't think about that unless you hear the pounding of your heart. But the primitive brain takes care of that. It also notices if you're low on fuel. It lets you know that, hey, you're hungry and you're thirsty, and it cues you up for that. But another aspect about the primitive brain is it is always monitoring and used to our daily movements. It pays attention to as we move from space to space and cues us up relating to those activities. For instance, if we were at work and then we finally drive home and walk in the door, there's that sense, okay, I can relax now. And you feel that heaviness come upon you. That primitive brain says, okay, it's time to do that. Or, if you will, at a certain point at night, it's time to go to bed. Or if you walk in the kitchen, unfortunately, we've heard about this COVID-15, when you walk in the kitchen, oh, it's time to eat. Those different things, as you move from space to space, the primitive brain is used to that. And what we call it's those routines that we have in our daily life. We wake up in the morning, the certain activities that we do to get ready for the day, those routines we do throughout the morning, the transition from morning to afternoon, the transition from each day to the next. All those are routines that the primitive brain is actively a part of. And but at the same time, you notice if there's any changes to those routines, sometimes we feel out of sorts. For instance, if you have a holiday on a Monday, how oftentimes when you come back to work on Tuesday and Wednesday, you're constantly saying, oh, I didn't realize it's Wednesday. It still feels like Tuesday, things like that. So what happens when our routines are disrupted? The experience of loss of routines. The primitive brain is also then having a hard time because that disruption in the routine throws it off of balance and it forces it to work harder to try to again find something familiar. It's like the phone, if it loses signal and it's roaming and working hard trying to find that signal again. So how do we see this in older adults? And this is something I actually have heard from some of the facilities I've worked with these changes of routine. The older adults themselves will change what they do. And the brain itself is struggling. So what it does is it wants to hide, it isolates. And so that person themselves just wants to hide and having a lack of social interests. So it's not just necessarily the routines that are changed upon them, but they themselves change those routines. Or it goes into that hyper seeking mode. Again, trying to reorient it. And you find that with some older adults, where actually they're demanding even greater attention than what they normally do. Maybe they're calling you more or wanting you to connect with them more. Then there's also losing tracks of dates and times, what day it is, what time it is. And I'm sure as I'm talking here, and I'm going to ask you your comment here, how you've both experienced this, maybe yourself, what of these you've experienced, and what you've noticed with those older adults. Maybe you could add to this list. That memory and cognition problems, they've noticed older adults actually maybe are higher functioning cognitively, struggling more. And then maybe demanding and requesting more use of prescriptions because they're struggling. Again, on the chat feature here, I appreciate your input. Hear from each other. What ways have you seen this disruption, if you will, of our routines impacting maybe you and maybe those older adults you work with?
I'm not seeing anything in chat yet, but feel free to put something in chat if you've seen any of these things. This is Chris, and I will say for myself personally, losing track of dates and times, I tend to think every day is Tuesday, and it's a little bit interesting for me. And also kind of the fuzzy COVID brain. It's a real thing. I've read some articles about it. So memory and cognition. And we've got a comment from Donita saying isolation, not interested in socializing, but not having a problem with that. So just going ahead and isolating and being okay with it.
And that could very well speak as far as personality types, if you're introvert or extrovert too. Introverts may very much like the fact that they don't have to be out public as much, but again, showing, paying attention to that and knowing what's maybe normal or not normal for them. Any other comments? I know from my own mother, I've noticed her wanting me to call her more. And usually we would talk once or twice a week, and now it's much more frequent.
Have another comment, a quicker decline of dementia symptoms.
Yes, it's putting that stress upon the whole system, and they're always struggling in terms of coping, and you just add this layer onto it. Okay. All right. I think here's another one. Go ahead and if you read that.
Oh, Darla says that her mother has an amplified worry about catching COVID and dying, so higher anxiety.
Yeah, there's another example of signs of difficulty coping. Yeah. Okay. All right. So when it comes to, again, finding balance in the day, one of the things that you can simply look at, and we're not going to spend a whole lot of time on this, is, we look back at that 5 hours of empty space, and now maybe it's even more because of that isolation. But looking at ways that, what can I do productively today that gives me a reason for being here, and it makes a difference in other people's lives. Being intentional about that. What are things that I can do that restores my spirit and body? Getting out in nature and noticing the birds. And I noticed for myself, I was sitting back on my back patio and just listening to the birds sing. And when you're doing that, all the rest that's going on around you seems to disappear. Finding leisure activities that can make you smile, that you enjoy. And then self-care, figuring out ways, again, you may have to adjust your routines for this, but okay, find new ways to do these things. Now I'd like to shift to another aspect in terms of being a healthy older adult. And oftentimes we will focus a lot on the physical of the person, keeping them pain-free. We have lots of programs on living with chronic disease and keeping active and physically active. We build a strong medical system on that. Emotionally, we look at ways to provide social support and connecting for people so that they can feel supported and not so isolated. But there's another aspect here, and that's the spiritual. Here's a term here maybe you've not been introduced to before. It's called Anamkara. Actually, it's an ancient term, a couple thousand years old. It's a Celtic term, and it's a term that was used referring to individuals who were soul friends, individuals that paid attention to those individuals in their lives that maybe they were even assigned to, and finding ways to provide support that that person can experience peace in their life and be peaceful. And what I want to do is just briefly look at a couple of terms when we talk about spiritual or spirituality. First off, spirituality and religion are two different things. Religion really is that container in which the life of the spirit grows. We all have different containers in which hopefully we thrive and grow and provide the boundaries and space in which we can do that. And help us connect with what's really important to us. But lots of times in our spiritual health and addressing the basic needs of the spirit, we experience things that cause disease within us. And of course, on the left here, we have a plant that's issues are there, and paying attention to that and figuring out what is going on there so we can return back to that space where we thrive. In thinking about this, and no, this isn't Charlton Heston on the right, but image representing Moses. Every religion's intention is again to provide that space. So as Moses would say here, I set before you today life and prosperity, death and destruction. Choose life. The container in which we live in and use to help ourselves grow is intended to provide that space, let us know what is healthy, what is not, what can help us grow. And so it's important for our own spiritual health to pay attention. Am I experiencing disease or am I thriving? With that, I'm just going to briefly introduce you to a resource. If you're not familiar, it's called the Sacred Art of Living Center in Bend, Oregon. Started in 1996 by Richard and Mary Groves. Two things that takeaways from there is they end up providing training for caregivers. There's two different sites you can look at there. But one is recognizing that many different cultures have something to offer when it comes to our health and growth. But also looking that our ancestors, even those that we're caring for, are a rich resource for wisdom in terms of living well. One of the things that they look at is lots of times we end up looking at the medical model and we think about the pain that's very obvious. But oftentimes, though, there's much more to that. There's what's below the surface. There's what the person is experiencing in terms of suffering that the medical model often does not touch, and that we really need to pay attention to. Suffering occurs when we assign meaning to the experience of physical or emotional pain, or when we generate physical or emotional pain from our own thoughts or stories, how we perceive what's taking place. So challenges with that older adult in the pandemic, when they're suffering, contributing to suffering for them, is having to wait. As a result of waiting, lots of times a lot of the issues maybe that they've had to deal with are bubbling to the surface. They can't distract themselves maybe as they used to. But also experiencing a lacking of purpose because they're not able to do the things that they've done before, feeling overwhelmed, anxious, feeling abandoned. Are they abandoned? That's again the meaning that they place upon that, and finding no joy in the day. One model in terms of looking and paying attention to what's going on in the person is a model put together by Cicely Saunders, who is the founder of the modern hospice movement. She was a medical doctor in England. She saw that it was much more in terms of addressing the pain of the person. So she also got a social work degree and she got a theological degree because she recognized that the total pain of the person, if you look at this, it's like a prism, many facets to it, many perspectives. It includes physical, social, emotional, and spiritual pain, as well as the pain of the caregiver. And then recognizing that all of us, the caregiver, the ones that are receiving care, are all part of helping to be well. One of the things that she learned was as she was making her rounds, she had an old veteran that she would connect with each day who she was providing a lot of medications to. And those medications didn't just seem to fully address the pain that he was experiencing. Finally, one day she just sat down and visited with him. And as he was sharing his story, she noticed that the pain just seemed to go away as he talked. And she noted that acknowledging there really is a psycho-spiritual relationship to physical pain. And it's important for us in achieving a middle way between too much and too little treatment. We have to take the time to do that. One author that I like, Richard Rohr, says that pain which is not transformed is always transmitted. So we need to, again, pay attention to where the real pain is in order for it to be resolved. Otherwise, it gets transmitted across that spectrum. Carl Jung said that if you get rid of the pain before you answer the question, you get rid of the self, which is psyche, the soul, along with it. So we have to, again, pay attention, be patient, and listen. Speaking of the ancestors, from the monastic books, who were really the first hospitals in Europe, said it's necessary first to diagnose spiritual pain before attempting to respond to it. Again, speaking to the importance of taking the time. We're all familiar with the physical pain scale. You know, if you go in and if you have a procedure done, or if you're in the ED because something happened, they'll ask you on a scale of 1 to 10, what is your pain level? Is it a 10? Is it 1? I hope it's never been a 10 for you. But assessing where you're at. We also have the emotional pain scale, which lots of times with children, having them point where they are, whether they're happy face or sad face. But I'd like to introduce you to the idea of a spiritual pain scale and asking the question, how are you within? On one end, are you completely peaceful? Or on the other end, extreme anxiety? Proverbs says a person's spirit will sustain them in sickness, but a crushed spirit who can bear? And again, it speaks to the importance, again, paying attention. Is that person peaceful or they're experiencing extreme anxiety? With that in mind, when we look at what fills the day with meaning when it comes to the spirit of the person, there are 4 dimensions to it. It's to find meaning in each day, to experience forgiveness, to have connection with what is most important to you, and to have hope in tomorrow. We're going to see how that impacts in filling that meaning in each day. What they've noticed in studies that the patterns of spiritual pain, that 21% of individuals are experiencing meaning pain at any given moment in time. 22% are experiencing relatedness or connection pain to what's most important to them. 14%, unfortunately, are experiencing hopelessness, but fortunately, it is only 14%. And 44% are experiencing issues relating to forgiveness at any given moment in time. One of the things we need to look at as Anamkaras, as soul friends, is what kind of space are we providing where people can talk about their pain, their spiritual pain, and meaning, and forgiveness, and hope. One author that I like, Parker Palmer, said, "The soul is like a wild animal, tough, resilient, savvy, self-sufficient, and yet exceedingly shy. If we want to see a wild animal, the last thing we should do is go crashing through the woods, shouting for the creature to come out." So it is important for us as we engage those that we care for. Are we providing the space where their soul, their wild animal, will come out and feel free to talk about what they're struggling with? And that goes with our own self-care too. Are we doing what we need to do where we feel safe and we're taking care of ourselves so we show up in the caregiving process? In terms of looking at these 4 qualities of spiritual pain, again, it shows they've done studies and showing that in an environment in which there's a lot of judgment and criticism, patients are much more demanding in terms of pain medication. But if they're in an environment where it's supportive and caring, the request for pain medication goes down. And the wisdom of our ancestors says the only cure for spiritual suffering then is to be able to lean into the pain. And those that we care for will not be open and vulnerable to us to lean into what they're struggling with unless we provide that space of compassion and support. So it helps us then to be prescriptive about it. With that, I'm going to introduce you to the spiritual health assessment, and we're going to be walking through that. I'm going to encourage you to participate for yourself as to where you're at as we go along to it. And this spiritual health assessment actually is available on that site that I mentioned earlier with the Sacred Art of Living Center, and you can pull it off from there. First one, how are you within today in terms of meaning? Ask yourself, right now, is life filled with meaning and purpose? Is life good? I know what I want to accomplish. Then skipping over 3 over to 4 is I lack energy to accomplish what I want to accomplish. Or 5, life has become meaningless. Notice I skipped over 3. 3 is a cop-out, as they would say. Lots of times we need to pay more attention to where we're at on either side of that. And again, I encourage you to practice this for yourself. If you do so, you'll be much more sensitive and aware and pick up on it on those that you care for. In terms of meaning, what we do is we ask, why am I here? Why am I here today? And meaningfulness, if we have meaning, it makes us well no matter what's going on around us. But meaninglessness makes us sick. With that, I just wanted to share a little bit a story about 2 people that were very important to me, and that was my father and my grandfather. With both of them, they struggled with this like all of us. My grandfather, when he was a young man on the farm in the early 50s, he was involved in a farm accident that ended up he lost his dominant working hand. And as a result of that, of course, he didn't see himself that he could be a provider anymore, lacked that purpose. and he was rather overwhelmed, and waking up each day and facing the challenges of every day was just too much for him. There was no joy. My father, he actually passed away in 2001 from chronic lymphocytic leukemia at a fairly young age of 63. He had struggled with this same issue. I remember the evening when we as a family were in his hospital room, and the doctor came in to see him after a rather aggressive treatment in terms of addressing the cancer. And the doctor essentially told him then, he said, Paul, he says, this is the last real thing we could do to try to stop the cancer. Everything after this is simply going to be palliative. And I remember as we were digesting this, the rest of the family walked out, and I'm sitting there with my father. And I remember him saying to me, he says, well, I guess it's just time to take the pill. If you know what that term is, being here in Oregon, it's just to have this physician-assisted suicide. When I heard that, I was rather, it took me back because this is not a conversation we had before. But thinking it back between judgment and compassion, instead of saying, Dad, you can't do that. We don't believe in that sort of thing. My response was, Dad, what's the reasons why you would want to do that? And he began talking to me about how he always saw himself as a provider for the family, and how now he no longer saw himself being able to do that, but instead seeing himself as a burden for the family. And as a result, he didn't want to be that burden, and he couldn't see himself again fulfilling the role that he was always important to him. And my grandfather, going back 50 years, he actually considered the possibility of having an accident and dying so that his wife and 5 children could be provided for through insurance. Now, my grandfather, he actually was able to work through that dark time. He was a resilient, strong man, and he showed us how to press on and to continue to do the work that he was doing, even though he only had one hand. My father that evening, as he said that he can no longer provide for the family, immediately what came to my mind, I said it to him. I said, Dad, you're still going to provide for us. And he said, well, how? I said, you're going to provide us the opportunity for us to provide support and practice what you have taught us with you. And secondly, as you begin to go through the process of facing death, you're going to be teaching us how to do that, both me and your grandchildren. And I'd have to say, in the months that followed, he did exactly that. It didn't mean that he didn't struggle, but by being willing to lean into the pain of meaning there, being willing to lean into the spiritual pain, he was able to then be that mentor for us and help us along the way. Another thing in looking at cultural barriers to meaning. Again, not being able to take the time to look at what's really meaningful. We get so busy on that hamster wheel, and we get so distracted that we lose track of what's meaningful to us. These barriers, including speed, busyness of the day, information overload. One of the things with this pandemic, if you will, can be a blessing in that It's forcing us in some ways to slow down and to reassess what's really important. It gives that opportunity to reflect, to find new purpose. And as we have those discussions, and as I had that discussion with my father, as we face the loss, it gives space for something new. And for my father, it gave him the space to see something new, a new role of being a mentor and helping us learn how to face death. Another resource that you can do in terms of providing care and having the dialogue with your loved one is something called spiritual geography. And that's where you end up doing life review with your loved one, where they share the joys and the sufferings that they've had all throughout their life. And it gives them the opportunity to both reflect and see how they've been resilient through that time, as Parker Palmer said, but also opportunity to share with you where you can learn. And then this can also then move on to a weekly option where you look at what's been the joys and sorrows of this last week. And hearing, you might be surprised what you hear. Another resource out there now is called Time Slips. And at this site, and part of it is for those that are struggling with even memory issues, that it's helping those elders in creative ways to find meaning and purpose. A couple of examples of that. First off, they provide these different pictures where you can make up a story. As we see this young boy who got into the cookie jar, looking at a picture with that senior or groups of seniors and saying, so what's going on there? What's that boy thinking? What do you think the dog's doing? What kind of cookies are they eating? And going along, and they end up making that story. And it's not so much, I mean, it's again the opportunity just to share, and they'll end up revealing things about their own life, maybe when they got into the cookie jar when they were a child. Another thing is asking a beautiful question, and they have a whole list of questions that you can look at on that site. But these are just different examples of where you can have these questions. So in terms of responding to meaning, here's a couple of examples or a few of examples of things that you can do. Any thoughts on your end, some things that maybe you have tried in terms of having dialogue, like even storytelling that you've experienced? There's the opportunity to share in the chat.
And while people are, excuse me, typing in their thoughts, I will share one. My mom was really struggling with feeling kind of stuck and in prison, as she calls it, having to be at home. And we got to talking about their lives. My parents were children in England in World War II, and they were talking about the sacrifices they had to make with food rationing and being, they actually were bombed, things like that, and how helpful that was for me personally to just kind of have the oomph to move along through the pandemic. And I shared that with others and helped them. I told my mother that that was helpful to me and helpful to others, and she just lit right up. And it just flipped a switch for her. It made her really happy to know that she had been helpful to other people with a part of a story of her life.
Thanks, Chris. Thanks for sharing that story. Storytelling is so important. What it does, as Richard Rohr says, it transforms maybe a painful experience they had, it transforms it into something good. There's been so many times I've sat with elders who are sharing their stories, and they share things that they've told me that their family has never known. And as they're sharing with me, I'm reflecting back to them how helpful and meaningful that was. And it begins to be an opening process of sharing those things with their families.
And I am not seeing anything else in chat.
Okay. So the next one is forgiveness pain. What is it I need to let go of? Sometimes the offense that we need to let go of or the thing that maybe we've even done that we need to let go of has happened years ago, maybe even generations ago that we need to let go. But because of it, we're still struggling with it. Joan Borisenko said that any attempt to access the human capacity to forgiveness is guaranteed to enhance the immune system, therefore enhancing a person's state of body, mind, and spirit. Notice any attempt, if they even just consider the possibility of forgiving, it actually does a switch within their body and helps them begin to heal. So, looking at forgiveness now, how are you within today? I feel a deep sense of reconciliation towards myself and others, or I feel a strong sense of unforgiveness towards myself or another person. I want to introduce you to a book here by Dr. Ira Byock, who is a physician and palliative care specialist. He wrote the book called The Four Things That Matter Most. And again, palliative care. Why palliative care? Well, actually, again, it's from the Sacred Art of Living Center. They said the dying are our teachers about living. And one of the experiences I live in Pendleton, Oregon, and I coached cross country for years, young children. And one of the boys that I coached, when he was 21, he was in an automobile accident that took his life. And as I co-officiated with a tribal elder in the service, the elder referred to this young man as an elder. And it kind of took me back. I said, he's only 21. How can he be an elder? And what he said to me is that an elder is one who is closer to the edge of the sacred circle of life than you. So it is with our elders. What they can teach us as they've gone through life can help us in terms of living. And with that, what he learned is the first two things that are most important things, more than medical, most important things is being able to say, please forgive me, and I forgive you. Please forgive me. I know an elderly gentleman that I worked with who was struggling, having nightmares as he was in hospice, relating to issues that he had buried long ago and nobody knew about. But as him and I had a dialogue, he was able to talk through what was going on, where before he said, maybe someday God would forgive me, he was able to come to the point for himself where he was able to receive the forgiveness that was always there, but he had to be willing to realize he could offer it, have it. And even his wife said that in the last days, he was very peaceful, a smile on his face, thankfulness in his heart as he crossed over to the next life. The thing is, on those two things, is forgiveness is two ways. We cannot receive forgiveness unless we're able to let go of things that we're offended of. They cannot occupy the same place. We find this universal law of forgiveness in many different religions and sites. It's also found in the Lord's Prayer. And forgiveness, and also the next one, relatedness, we cannot heal unless we are connected with community. And it's important for us to be there and supportive of those loved ones and those that we care about. So here are four different ways in which you can provide support in terms of forgiveness. That life review, where individuals, again, are able to talk through what's going on with them, gives the opportunity for you to hear their pain in that area. 12-step exercises, which we're all familiar with. Breath work, meditation. The third one, and I'm going to be moving on here a little bit because we're running out of time, is relatedness pain. What am I committed to in life and death? Notice, what am I committed to? It's not necessarily just a person, but as Thich Nhat Hanh said, spiritually, it is who or what we are in relationship with that creates a sense of harmony and longing. When core relationships, whether with persons or things, are out of balance, the emotional and physical bodies inevitably become diseased. And our need to belong to value groups and relationships is so powerful that if frustrated or thwarted, serious negative health consequences follow, including suicide. In my years working at the hospital, I would note how many times older men who, within a couple of years after they retired, they would come into the hospital with a heart attack or dying. And so oftentimes you saw it was that disconnect with those relationships and those roles that maybe they had in their work that they were not able to adjust to or able to let go of. So it's important to, again, recognizing those connections. As Ira Bio says, I love you. Meister Eckhart says, what keeps us alive, what allows us to endure, I think, is the hope of loving and being loved. So in terms of connection right now, where do you find yourself today? I feel a strong sense of connection with the persons and things that matter most to me, or I feel seriously alienated from something or someone that is important to me. As you're doing this for yourself and as you help those elders do this, it provides that opportunity for conversation to understand what it is that they are struggling with in terms of connection. Loss of relationship with those you love, loss of identity and role, loss of routine and familiar activities, as we talked about earlier, and loss of connection, which leads to experiences of grief. And this is so key, so important. And I've heard this so many times, even in care facilities where maybe this opportunity is not given, where it's important for our elders to share their grief, the emotion, thoughts, and stuff they have relating to someone or something they've lost. And during this time of pandemic, that sense of loss can be even greater. And by sharing, that's called mourning. It's grief gone public. By mourning, that helps that person heal. Jesus had said, blessed are those who mourn, for they shall be comforted. And that's a true, true saying. So here's some other examples of responding to relatedness pain. Getting out on a nature walk, therapeutic touch, healing arts, and religious rituals. And those religious rituals, sometimes we think about in terms of a funeral service, but religious rituals could simply be a moment, a space where maybe even light a candle, acknowledge what it is you've lost. Any thoughts here of examples of what you may do or that you're aware of that helps people relating to connection or relatedness pain?
I've got a comment of walking by the river with your dog.
Yeah. What that does for you is what? Reconnecting with what matters most. We could be in a stale environment. Again, thinking about some of these items, how you may have to adjust them if a person's not able to get out as much. How can you still do these things in some way to help them connect, to help them acknowledge what is lost? So finally, the last one. Oh, we've got another comment.
We do, yeah. Darla says gardening and watching things grow, painting toenails, hooray, family prayer, all been part of what I've been involved in with my mom. I love that variety.
Yeah, yeah. I'm not sure if my mom would want me to paint her toenails, but it sounds like it could be fun.
Yep.
So this last one is hope pain. What does the future hold for me? A big question during this time for us all, doesn't it? We were often refer to this as hope pain as the terminal illness of spiritual pain. When you lose hope, you don't see a tomorrow. It's hard for you to see past the dark veil. In terms of hope today, how are you within today? I feel hope filled and optimistic, or am I experiencing deep depression and hopelessness? A couple of questions that helps you kind of work through that down below is, what dreams keep you alive? Why might I feel depressed or hopeless? Again, leaning into the pain, being able to talk about that. Hopelessness, as I said, the terminal illness is spiritual pain. In Oregon, starting at 65, you could see suicide rates gradually going up to where by age 85, a third of the population of those that are 85 and older, part of that population of the suicide rates. Astounding. Here in Umatilla County, when it comes to depression, 13% are experiencing depression right now if you're 65 and older, 14.5% across the state. And again, we encourage you to look at those sites that we referred to as earlier. You can see the statistics that are available there. So finally, as far as the four things that matter most, thank you. The importance of showing appreciation. Mother Teresa said that there is more hunger for love and appreciation in this world than for bread. We've seen this on TV, how many elders were nursing homes fighting pen pals. We just all need to know that our life matters, that we're appreciated, that we're valued. Providing that opportunity to let them know that. But also be able to practice gratitude on the other end. Helps you reframe the darkness. Meister Eckhart said, if the only prayer you say in your whole life is thank you, that would suffice. And I know personally, I can speak to that. Back when I was turning 20, I was working on a road construction job and was involved in an accident that almost took my life. As a result, I experienced brain injury. I experienced severe fractures in my face and throughout my body and injuries. And as I was laying in the hospital in the days to come, I was having a hard time seeing a tomorrow for myself. But only when I began to practice gratitude, when I began to look for the little things that I could say thank you for, this is a good thing, that the veil began to lift. And they've noted that individuals who do this and practice this, finding 3 things to be thankful for each day, it really rewires the brain and they begin to see the world differently. In many different cultures and religions, for example, the observant Jews, when they wake up in the morning and still in bed, they practice saying, I give thanks, and starting the day and giving thanks. So in terms of hopelessness, Here's some great examples of expressing things. There's the expression of gratitude. Journaling is a good one because you can write down the things you're thankful for, and then you could read about it again, remind yourself of that. Vigil practices of honoring and recognizing what you're thankful for, and music therapy are many examples. So the impact of meaningful activities as older adults improves cognitive function, improves life quality. It does many things here, as you can see listed here. These slides are going to be available to you. There's other resources that are at the end of this presentation that you can look at. But our job as caregivers is providing the right support and the right care. We can help them fill their day with meaning. Any thoughts or questions at the end of this? Someone had actually something to share.
Yeah, there's a comment of having something to anticipate has been helpful in working through depression. It goes with gratitude and hope.
Yes. Having something to anticipate, something to work for or look forward to. Yes. Any other thoughts or questions that you might have? I wanted to thank you for joining me today. There was a lot of information. Somebody else just had something to share, a lot of information that I wanted to share with you. Hopefully you found it useful, something to think about. Chris, can you share what that person had to share?
Yes, Donita's asking if we'll be able to get a copy of the presentation. And yes, you will. And I will, there is a link on the first slide, but I will make sure and send that information out to everybody. So you can go to the Oregon Office of Rural Health website and look that up and see it.
Yeah.
Beautiful. Thank you, Chris. Thank you, Rod, for presenting today. The slides and the recording of this presentation will be available on the Oregon Office of Rural Health Forum on Aging webpage, and Chris will get that information out to everybody. So we're a couple minutes over. If there's any last thoughts, please type them in quickly. Otherwise, you've got Rod's email address down there, and thank you so much for joining us today.
Thank you.
There is a TY good presentation with a smiley face.
Thank you very much. I'm practicing saying thank you. Appreciate that.
Thank you so much, everybody.
Thank you.